If you could tell me about, with your experience, what was COVID like?
The best analogy I have is it took the, 30 or so years of AIDS research and compressed it into about, 3 months. I mean, it really was a bit of some of the same things, urgency, new disease. It was different in terms of the epidemiology, obviously, but the sense of urgency was very similar. I actually was part of the first WHO delegation to China. So I was in China in February of 2020. And what was interesting was I saw the extraordinary measures that they put in place. It was such an intense time. I mean, we were working literally around the clock. I came back from that experience, seeing what was going on in China, my area being research, particularly looking at therapeutics, to a lesser degree vaccines. And what we saw, that they were studying all different things, but without any prioritization or central coordination. So again, coming back, we decided at NIH we had to launch, and we were already launching a remdesivir study, that we had to launch a series of multi-center clinical trials on a global basis to make sure the most promising things got studied first. And that is an enormous amount of effort focused in on getting patients on studies so we could learn.
I assume that the research into COVID-19 is ongoing. What are some of the short-term as well as long-term studies that you are conducting right now?
We are still trying to identify the best ways to treat this disease. We do not know the role of antivirals in the hospitalized patient population. We've got pretty clear data that they're of value early on in ambulatory patients at risk of severe disease. We give a 5-day course because that's what's authorized under the emergency use authorization. And even with the recent licensure of Paxlovid, we're still bound to only prescribe under the emergency use authorization. So 5 days is what's there. Is 5 days really the right duration? Is 10, 15 more appropriate in certain circumstances? If you move over to the vaccine side, we still have a lot of unanswered questions. We don't have a clear, easily measurable correlative protection. So how often we need to boost, what platforms are best for boosting.
What lessons do you feel we've learned right now from COVID-19?
I think we've learned that we can, on the part of the US government, to mount a research response, all out, that we can do phenomenal things. I mean, the development of the vaccine, the development of the monoclonal antibodies for therapies, the development of the antivirals. Some of that was US government, some of that was private industry, but we can really, if we put our minds to responding, we are able to respond, and I think respond quite effectively.
And what do we still don't know about COVID-19?
As I was mentioning earlier, we're not really sure the optimal way to treat a patient who's hospitalized with COVID-19. The role of antivirals alone or in combination, the role of what immunomodulators are best to use. For vaccines, we don't know how often we need to give a boost and exactly what that boost should look like. And all these are things for which we can generate, I think, pretty robust hypotheses and then test them as we go forward.